Okay? The surface antigen is almost always present until it resolves. Okay? The total anti-HBC is a definite marker. And when you have occult infection, this may be the only marker that you see. Okay, so you can see in the chronic active, you'll see the Hep B surface antigen is present. The antigen may not be there. When the patient goes into the chronic carrier state, the S antigen is still present at a lower level, and the anti-HBE may appear. And then once infection is resolved, anti-HBE, again, that may or may not be there. But the ideal state would be to have anti-HBS. And HBS-AG becomes negative. Okay? So you go staging of acute infection and chronic infection here to resolution. So this is the use of different markers. This is an algorithm in the UK of how they go into this flow. So the first assay they use is a surface antigen assay. If reactive, they run a confirmatory assay, which is a neutralization assay. So this specifically confirms the surface antigen is there or not. So remember, this is when the patient appears with clinical symptoms, so it may be acute infection. After testing the surface antigen, you go on to test the anti-HB core antibodies. So if you test with a total and it's positive, then you can discriminate using an IgM. Okay? So then the IgM positive, this is definitely acute infection. If it's IgG, then it will be a more chronic stage, and it may be reactivation. If the anti-HBC is negative, you can go to DNA testing as well. And then after all this, after diagnosing infection, you can go on to looking at the E antigen. Is it there? Is anti-HBE appearing? Okay, so this is going from acute to staging. And then the surface antigen, we have a quantitative assay for treatment monitoring as well. And they also use a DNA for treatment monitoring. Okay. This is an alternative flowchart they propose if you're limited in the assays on the market here. They recommend you use one surface antigen assay, and then you confirm using a distinct surface antigen assay, which means a different vendor, a different manufacturer. Okay, and then based upon the reactivity, if confirmed, you go on to testing the anti-HB core. So this is if you don't have a neutralization assay for the surface antigen. They recommend you confirm with another additional surface antigen assay.
Which is the better of the two?
We recommend using the neutralization assay because by putting in the antibodies, you see a specific knockdown. This can still be false positives on two assays due to poor. Here. So here, this is something to note. Hemolyzed samples are prone to give non-neutralizable false positive results. So if you're doing an algorithm where you're using two surface antigen assays and you have a hemolyzed sample, you've got a double false positive. Okay?
Why do you say repeat from original sample?
So here?
No, that second, why do you say repeat from original sample? Why not the second sample?
Because you have to, if it's something inherent to the tube, then perhaps the confirmatory assay will show it's a non-specific interaction. Okay? And sometimes, again, is the patient there for you to draw another sample?
Regarding this assay, HBsAg done by two different companies. We also come across that it sometimes comes positive with one, but comes negative. So how do you solve this problem?
So here the guideline is if negative, then you would repeat both tests again.
And again, if it's the same,
Huh?
the first time positive, the second time negative.
Then you go on to the antibody testing because anti-HBC, or you can ask them to come back. So that can be the solution.
Usually,
But
what we do is, if we get both positives, we label the person as positive.
yeah.
One is negative and one is positive. We call them again after 6 months. We keep it under surveillance.
Sure. Do you run an anti-HBC, Toto?
There has to be a panel, right? There has to be a pan-self test.
Yeah.
Having the 4 antibodies as well as the antigens, so you can sort of the patient any stage he is.
So if the anti-HBC is reactive, almost positive. Okay.
And in case of maternal transmission, do you have a flowchart for that?
Maternal transmission. So again, you can't really do antibody testing. You're restricted to the surface antigen, which is unlikely, but DNA is probably your best bet in that regard. Yeah.
How long after a vaccination of hepatitis B does it take for the antibodies to start appearing?
That's a good point. If you vaccinate with Hep B, the vaccine-associated antigen is detectable for up to 2 weeks. So after vaccination, don't do the surface antigen test because it could be the vaccine you're picking up. So wait probably at least a month before you retest for antibodies or antigen.
Antibodies after 1 month, because the schedule is 0, 1, and 6 for the vaccine. So after the second shot, you check out for the antibodies.
I think they say after the third shot, 4 to 6 weeks after.
After the
Ideal is
fourth.
6
To be
weeks
100% correct.
Yeah, after the third shot. After the third.
to determine whether they are.
Yeah. I think you almost always give the full course of vaccination. So
When they will stop, you might have the titer of the second shot.
Yeah.
But they recommend finishing the 3 courses and then
Yeah.
testing.
Because practically there's a certain season when we get students who are going abroad.
Yes.
And they need to either take the vaccine or produce a hepatitis surface antibodies report. So they either take the physician's certificate or the pathologist report. So I guess it solves.
Yeah. If they ask our opinion, it should be one after finishing the third.
Yeah.
But they don't have time.
No, then the physician has to certify
Yes.
yes, given the course. And they test it in US.
What do you label when a person is anti-HBsAg positive and you're given anti-HBC negative? What do you do for that?
sorry, anti-HBs positive.
Yes,
Or
Vaccinated.
Yeah, that would be that's likely vaccinated individual.
you have one slide.
HbSAg positive.
Anti-NPS positive.
Okay.
Or negative. I think we should be winding up. Sorry, I think EVV is still pending, but we are running.
Sure,
short of
it's
time.
understandable. Okay, I'm open to discuss it after. So okay, so
Round of applause for Dr. Caelum for.
okay, thank you.